Good morning, everyone. I also greet those who are online. Good morning again. Thank you. Dr. Njenga, Dean, Strathmore School of Business. I also recognize Dr. Frank Wafula, all the representatives of the Ministry of Health present, and the representatives of the state departments, agencies present, and all the representatives of the Kenya Health Care Federation, other members of Strathmore Business School, distinguished guests, ladies and gentlemen. I'm here this morning. I'm very delighted, and it's my great pleasure and honor to represent our Chief Administrative Secretary, Dr. Rashid Aman. Kindly accept his apologies. Like just our Dean has said, he has been called to other duties outside the country, so he would have liked to be here. But I'm happy to be here to represent him. And just before I read his message today, allow me to just say one or two words, kind of also react to what Dr. Njenga said. As a public health specialist, I have worked before in programs, TB programs, and what gave us a real boost in the TB program at that time, around, I worked there for about 7 years, from 2001 to 2008, around there, was placing quality at the center of the service delivery at the TB program, where we introduced as a program the quality assurance mechanism, in which we ensured that the quality of the data that was coming out was credible. The quality of the tests done were credible because of the internal quality control and the external quality control measures that were put in place. Because every time the experts came from outside to listen to our reports, they would pose a question. How sure are you that the treatment success rate is actually 75%? Initially, we could not understand what they meant. But when we interrogated ourselves, we realized that we didn't have the quality assurance mechanism within the laboratories system. So when that was introduced, and then the true positive, true negatives, and false negatives and false positives were put on check, we were able to post accurate results. And then I think the country went on the road towards achieving the Carol Stiblos Award as the first sub-Saharan country to attain the WHO targets of treatment success rates. So with that, we were able, most of us who participated were recognized, and we are still happy to date about that. So to me, the challenge to all of us as the private sector and the government coming together, if we can instill quality care, quality at the center of our service delivery, that will really take us very far. Even as we move towards manufacturing, the quality assurance, we have to ensure that what we produce will be very safe, both internally, consumption within the country and outside. Because I want to believe that even as we apply the technologies that we get from our good researchers, can be marketed, be useful to the whole world. So I am happy to mention quality care because that's where also that is where my directorate center of focus is. Quality, health standards, quality assurance, and regulation. And I'm happy that we've been partnering Dr. Frank Wafula in recognizing those who have achieved, who have excelled in providing standard healthcare before the healthcare awards scheme. So thank you, Frank, for that. So without wasting much time, then you allow me to read the message from our Chief Administrative Secretary on this occasion. Ladies and gentlemen, I am delighted to address this annual Health Summit, aptly titled Innovations and Sustainable Solutions for Healthcare in Africa, Resilience Beyond the Pandemic. This is coming at a time when the global community has been facing unprecedented times with a myriad of health challenges affecting sustainable gains made over time to improve health outcomes of populations. As we continue to contain the pandemic through various public health measures, we are looking forward to building back better after realizing the central places of sustaining availability of health products and technologies for better preparedness and response in future. Distinguished guests, we recognize that pharmaceuticals are critical to the economic and social development of Kenya. The medicines treat diseases, save lives, and promote health. They are also a core component of the right to health, the key to objective ensuring universal access to quality essential medicines, essential health technologies, and pharmaceutical services in Kenya. Overall, the health sector strategic focus is guided by the country's blueprint, Vision 2030, and the Constitution of Kenya 2010. The Kenya Vision 2030 aims to transform Kenya into a globally competitive and prosperous country with a high quality of life by 2030, while the Constitution of Kenya 2010 guarantees the highest attainable standard of health as a right. The policy direction envisages that in investments in health system will be scaled up for improved health outcomes. One of the 8 orientations or investments areas of the Kenya health policy is the health products and technology. The HPT investment area seeks to ensure that effective, safe, and affordable health products and technologies are available and rationally used, while maintaining a strategic national health products and technologies reserve. However, in line with the increased focus through the universal health coverage and sustainable development goals at the global level, this strategy seeks to provide clear direction on HPT supply chain agenda. This program, which is in line with the Sustainable Development Goals 3, as an overarching goal to ensuring that all citizens have access to safe, effective, quality essential healthcare services through including affordable essential medicines and vaccines without going into poverty. As such, the policies, regulations, systems, and practices regarding health products and technologies have a direct bearing on access to quality and safety of healthcare services delivered to citizens in need. Ladies and gentlemen, to address the availability and access to safe and quality HPTs, Kenya has developed a health products and technology 2020-25, which envisions a sustainable, resilient, and responsible health products and technology supply chain system, with a mission to provide a steady supply of quality and affordable health products and technologies through a functional supply chain system. This strategy identifies 6 key pillars for the attainment of stated vision, including building capacity for scale-up of local production and full exploitations of TRIPS, that is the trade-related intellectual property rights, flexibilities for health products and technologies. Distinguished guests, Kenya is committed to establish a human vaccine production facility as part of the country's ongoing efforts to enhance its healthcare capacity and accessibility to improve vaccine access to the population. In this regard, the government of Kenya welcomes the ongoing dialogue on vaccine production and welcomes support to realize self-sufficiency in vaccine production and welcome support, in production, of healthcare goods and position itself as a regional leader in pharmaceutical products. It is good to note that the government is already engaging international partners involved in vaccine manufacturing to allow for technology transfer as it seeks to enhance the country's capacity in the areas of research and development. This will include setting up of a basic infrastructure to host the fill and finish facility for vaccine production. This will be accompanied by the establishment of a full-fledged bulk antigen production facility and biological products research and development center, as well as a capacity building with a focus on research and development to further strengthen this process. This decision to fast-track the development of a human vaccine facility in the country was prompted by the recent shortage of COVID-19 vaccines that slowed ongoing mass vaccination drives, especially across many African countries. In conclusion, I would like to reiterate the government's commitment in closing these gaps through leveraging the opportunity that this summit provides to galvanize experiences and insights for experts in government, academia, and industry to refocus the continent's needs and work towards sustainability through supporting local innovations and entrepreneurs in finding solutions and scaling this up to reach the entire population. I take this opportunity to thank all stakeholders who continue to support this noble cause and indeed reaffirm the fact that we will not let quote unquote good crisis go to waste. In disaster risk management terms, that is building back better so that you don't fall back to the same level if the same event takes place. So I wish you fruitful deliberations. Thank you for your kind attention. Thank you.